Hello, and welcome to another webinar in our Moving Forward series. My name is JJ McMurtry, Dean of Liberal Arts and Professional Studies at York University. I want to start by thanking the team of people from my office who have been working hard to put this series together. Thank you. A special welcome also to our guest panelists, and thank you also to our very special Associate Dean, Lily Cho. You'll be hearing more from them all shortly. I'd now like to acknowledge the fact that many of us, wherever we are in Toronto, across Canada, or around the world, are sitting on the traditional territories of different Indigenous peoples. Although we aren't all in the same location, we recognize many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of York University. York University acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Takaranto has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat. It is now home to many First Nations, Inuit, and Métis communities. We also acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. So welcome again to our guests and to everybody joining us here on Zoom to the next chapter in the Moving Forward webinar series. During this panel, we will look at the response of one not-for-profit agency to the COVID crisis. We will hear from 3 York graduates who are key leaders at the Canadian Centre to End Human Trafficking and discuss how the Centre is adjusting to new risks and opportunities during this period. If at any time you need help with this experience or have questions for the panelists about the content, please feel free to click on the Q&A button on the bottom of your screen. Our team is here and ready to help you. So enough from me. Now I'd like to hand things over to Associate Dean Lily Cho, who will introduce our guests. Thanks, Lily, and thanks everybody for attending.
Thank you, JJ, and welcome. I'm delighted to be here. My name is Lily Cho, and I'm the Associate Dean for Global and Community Engagement here at the Faculty of Liberal Arts and Professional Studies at York. And it's my great pleasure today to host this webinar to talk about how COVID is affecting nonprofits and non-governmental organizations. Today, we're joined by 3 distinguished York alumni, and I'm going to call them up and ask them to introduce themselves in turn. And so first, I would like to invite Margot Franssen to our virtual stage. Margot, will you please introduce yourself?
Thank you so much, Lily. It's just great to be here. I am the co-founder and co-chair of the board of the Canadian Centre to End Human Trafficking that runs the Canadian National Hotline for trafficking victims of labor as well as sex trafficking.
Thank you so much, Margot. Next, I'd like to welcome Julia. Julia, will you please join us on the stage here?
Hello, and thank you so much for having me today, Lily. My name is Julia Drydyk, and I'm the Executive Director here at the Canadian Centre to End Human Trafficking. I'm so excited to be joining as a York alumni, a proud alumni in the Political Science and Women's Studies Department. So I'm thrilled to be here with all of you.
It's so great to have you here. It's like a mini reunion. And to complete the reunion, I'd like to invite Ashley. Ashley, if you could please come onto our stage, our virtual stage, and introduce yourself.
Hi, good morning, everyone. Thanks for joining us today. I'm the Director of Stakeholder Relations at the Centre. So I do a lot of work with different groups across Canada, like police and governments, frontline delivery partners, and survivor leaders to enhance best practices and reduce duplication of efforts across Canada.
That's so great. Thank you so much, Margot, Julia, Ashley, for joining us today. And I am just thrilled to welcome everybody here in the audience too. I know that we can't be in a room together, but we can feel your energy and your presence. And thank you for taking part in this incredibly important conversation. I'd like to start actually by inviting Margot to give us a bit of an in situ, medias res, summary of how COVID affected the operations of your organization during that sort of crucial moment in March when everything suddenly had to shut down and we suddenly had to do things that we had never done before, like close airports and not travel and close offices, and we've never done this as a nation together before. And you're a national organization. What was that like?
Well, we were, my co-chair and I were flying into Toronto on March the 3rd. And we were flying in to make a change in our top management. And we had decided that we would take over as EDs for as long as it took to find another great one. So March the 3rd, March the 6th, we take over. March the 16th, the entire city of Toronto shuts down. And we have only been managing for 6 days. She, by the way, went home to Calgary. I was supposed to stay for 2 weeks. She was supposed to come back after 2 weeks. I find myself there with a lot of people who are looking at me for some leadership, and we have to send everyone home. And this is fine for the people who work in our office. But at the very same time, we're thinking some people are working off a kitchen table, some people have children, some people don't have strong internet, all things that can be fixed, all things that can be remedied and worked through. But the one thing that couldn't is that our hotline for human trafficking victims had to be shut down. And the reason for that is because we were operating under a contract with public safety that did not allow us to work remotely. So while all the rest of our employees could work from home, the hotline, with no warning whatsoever to trafficking victims who used us on a daily basis, had to be taken down. And it was devastating for us. So we called public safety. We told them the situation. They couldn't believe that they had given us a contract that we couldn't work remotely. So they basically said, hang on. And a couple of days later, we received a message from them that they had made us essential workers. And therefore, 2 hotline people at a time could come into the offices if they could drive, bike or walk, and come in working 6 feet apart during the busiest hours between 10 and 7, wear masks, and operate truncated in that form. Of course, it's not ideal, and we were just scrambling to try to figure out what to do. But, you know, we have the very best public service that I think money can buy or that you can hire. And they called us back and they said, we have changed the contract and we are happy to tell you that you can now work remotely. What is it that you need? So we told them everything we needed, the money that we needed to do it. And within 1 week, we actually had all of our remote people who operated the hotline trained remotely, equipped, trained how to use the equipment, and up and running within 1 week. And that,
Wow.
I say, congratulations, Julia Drydyk, because she was in charge at that time of the hotline. And it was phenomenal. And, you know, what we really didn't know that we were going into was a crisis mode, helping people who are in a crisis. But what it gave us was this amazing little laboratory, which was just a great lesson in changing management and management change.
Oh, wow. I mean, this has so many echoes for us in the university. You know, we suddenly were finding ourselves doing inventories of who had laptops, you know, things like that.
Mm-hmm.
And I know, Julia, you were suddenly like, there was a sudden logistical component to your work where, you know, you have a service, there's a front facing service piece, but you also had to support all these amazing people that you work with. What was it like to try to make sure that people had internet, that they had the basic hardware, to sort of put together training in less than a week on a thing that, you know, suddenly we're all Zoom pros, but it's hard to remember that there was a time in March where nobody knew how to raise their blue hand. Can you walk us through some of what that was like?
Yeah, absolutely. And we're also lucky that we've got an incredible IT team and we've got great support from the board as well. So we really had some of the best experts supporting us and making sure that we got the right equipment to the right people, but also that we had the right security permissions in place because of the sensitivity of our data and the work that we do. But more than anything, it was about completely shifting the way that we work together as a team. So the work that we do through the hotline is really hard work. It can be really challenging with people dealing with multiple issues in their lives, but also our hotline response advocates need to work really closely together. So if there is an emergency call where someone needs to get out of an unsafe situation, you often have someone doing safety planning with them while the other person is looking up the most accessible overnight emergency shelter. So we had to completely change those communications dimensions to make sure that we were actually supporting each other in an ongoing way. And that took practice. So like Margot mentioned, it wasn't just about getting our computers and sending them to people. They needed to make sure that they had the tools at their disposal to be able to do that really sensitive, nimble work and really meet our callers where they're at.
That's incredible. And I can see how the kind of struggle to replicate that in-office collaboration must have been just a huge leap, because so much of what you deal with on a day-to-day basis is sensitive, is private, and also time sensitive. And so, as Margot says, crisis within a crisis. And Ashley, I know that part of what you had to do, of course, was work with your community partners, and that brought you up front and with the kind of frontline implications of COVID, and how it also, doesn't, it's not that it impacts one NGO or one nonprofit, that there's a kind of ripple or domino effect. Can you tell us a bit about that experience?
Sure. So just like we kind of realized we had to very quickly and nimbly adapt our own services, we also realized our partners did. So while we had that shutdown time, we realized that once the hotline was back up and running, we needed an updated referral directory of over, at that time, it was around 800 partners across the country. We needed to know how their services had been impacted by COVID. So we sent out a survey. We also did some of our own research. We did some follow-up calls. And between March and April, we determined that 1 in 5 services available to trafficking survivors across Canada had actually completely temporarily closed. And on a good day, it's challenging enough to be able to sort of make those service matches, especially in remote and rural communities. So that really had a major impact on the way that we were delivering services. But we really wanted to ensure that we had the most up-to-date information, so that when we are doing warm transfers of callers on the hotline, that we were giving appropriate information. And basically what we really realized was most of our partners deliver in-person services. And so because of social distancing and Health Canada regulations, a lot of those services had to switch to either remote service provision, which again creates barriers for this particular population because they may not have access to technology, or they were doing very limited service provision, so they were only providing basic needs. And some of those more complex services like case management and counseling weren't available for quite some time.
It sounds like you just had to pivot so quickly and put so many things together as an organization. Thank you for giving us that sort of overall run through. I want to come back then to a couple of things that you've outlined, and actually bring it back to York in a way. I know that you're all York alum, and you all did. Could I ask quickly? I mean, I think I have a sense of this, but just for our audience, what were the degrees that you did at York, or what did you study, or what were your majors? Margot, could I ask you to, yes?
I was a philosophy major.
Philosophy. And Julia?
I was a double honors major in political science and women's studies.
Oh, wow. And Ashley?
Well, I will say I always wanted to be a police officer growing up. So I actually did a certificate at Humber College for police foundations.
Great.
And then after that, I did an undergrad at York in psychology.
That's amazing. So you have all of these skills and studies in fields as diverse as psychology, philosophy, women's studies, and poli-sci, and you took this brain trust and used it to transform an organization that had been so focused on providing frontline in-person support to suddenly a whole different kind of organization in many ways, still with the same mission, but really like, as you've outlined, like really different. You had to be redefined in your contracts in terms of what you were providing. When you think back on it, what what do you think your, liberal arts or psychology studies did to prepare you for the kind of nimble thinking or critical thinking that you had to deploy when you were making these huge adjustments in terms of day-to-day operations, but also philosophical approaches to what it meant to define a crisis or what it meant to think of, I think every day now we think about how to understand what we think of as essential. So Margot, when you talk about what it means to be redefined as an essential service, to really think about what we as a society understand as essential to us and to our operations. So I wanted to open that up a little bit, and I know it's a little boring, but maybe I could do it in the same order that I introduced you all in, just so that we have some. We'll do more free flowing in a bit, but Margot, could I ask you to go first?
Yeah, it's so interesting because I graduated with a degree in philosophy and then went on to become a business owner, and then went on to work in the women's philanthropic field, and then worked, as the co-founder of this organization. And the thread that runs through it, that started with York University, was that of human rights. So it just seemed to be such a grounding issue with me that it was what held my feet to the ground and my head in the clouds, but my heart always in the idea of, we can do this well, we can do good, we can set an amazing example. And it was just one of those things where the good for all was really at the top of my head all the time. And, philosophy teaches you that. It teaches you how to be logical. It teaches you how to be compassionate. It teaches you to look for truth. And all of those aspects are needed in the subject of human trafficking. So, I thank York so many times for giving me that opportunity and for not being persuaded to become an accountant, for instance, because I don't honestly think I would be as happy as I am today had I done something that was just more focused and more directed.
Thank you so much. And it's just so important I think, for all of our students who are listening and for, our community members to know that sometimes the line between what you're doing in that first, year in your degree may seem very remote from what your grown up life will be, but that through line is what you have to hang on to. And Julia, do you find that there is, when you, sometimes in your day-to-day life now, you think, who knew this would be a thing that I'd be doing? Or do you have any of these moments where you think back about what you studied and you think, this turns out to have been something that is applying to what I'm doing now?
Absolutely. And I count my lucky stars every day that I get to do this work. It is so rewarding and it's so great to be doing work that you're passionate about. I've got to say, I think I use what I learned through my degree so much, I don't even think about it.
Whoa.
And part of it is because, especially in the early 2000s, the idea of critical race theory, intersectional feminism, anti-racism, social justice, those were radical ideas back in the early 2000s. And now we're seeing that it's actually more embedded in society. It's becoming more mainstream, that people really know and acknowledge it. So applying that lens, and also my commitment to social justice and making sure that what we're doing is intentional, that it's aligned with our values, making sure, sometimes we've got to make really tough decisions in this world. And Margot mentioned that. It was heartbreaking having to temporarily suspend the hotline. But we knew that if we did it and if we moved quickly and we did it well, we could not only rebound and get to a place where we're back in operations, but we could use it as an opportunity to grow as an organization by living through our values intentionally in terms of how we responded to it. So yeah, I am so thrilled with the education that I got at York, and I think I might be a good example of where it can turn into really tangible work in the field.
Thank you so much. It's just, I mean, again, like as you were speaking, I was also thinking back to what Margot was saying about, this idea of, I guess we now think of corporate social responsibility as a commonplace term. But certainly, Margot, when you were founding your business, when you were doing all of this work, I think you were pioneering a lot of it. And I'm sure that part of what, that involved was, thinking about philosophical implications of what you wanted to do in the world and how you wanted to make a difference in the world in the things that you did. So I just love how both of your comments are coming together. And Ashley, I mean, you did all this work in psychology after having done, a sort of more hands-on kind of training. And do you find that these things are now coming together for you in what you're doing now?
For sure. I think, really understanding the push-pull factors and what makes people tick, why we react the way we do. It's really allowed me to approach my work at the center with a real understanding of empathy, and it allows me to treat my colleagues and stakeholders and survivors with the right sensitivity and really an understanding of gender-based dynamics as well as post-traumatic stress disorder as well. So using that sort of on a day-to-day, managing relationships has been really helpful. So yeah, I really, I did a lot of electives at York. I did some history and I did some gender studies as well. But the foundations of the psychology program have come in handy for me, for sure.
Oh, that's so great to know. I love hearing these stories. So what people grow up to do because it's always kind of about paths that are not necessarily predictable. And I think hearing these stories is so important for all of us in our communities now, especially where we now know that there are no linear paths to most things and that crises of all kinds can hit and you have to suddenly adapt in ways that you could not have anticipated even a few months ago. I'm going to ask you a couple more questions, and if there are questions from the audience, I'll be feeding them to you as we go. But to come back to some of what you just talked about, I wonder if we could talk a little bit about gender. In fact, one of the things that I love about this series and just about all the people in this room is how we are looking at women who lead and the ways in which women who lead sometimes or maybe often lead somewhat differently or bring a different idea of leadership in ways that may or may not be gendered, but are certainly very much around creating communities, around just inserting different kinds of ways of thinking. And I wonder, maybe Julie, I'll start with you. If you find that the fact that if gender plays a role in the way in which you operate as a leader, as somebody who creates culture for your workplace, what is that like?
Absolutely. And I think, so I've been working in the nonprofit space for about 15 years now, and I don't think it surprises many people that it's a very feminized field, right? Like there's a high proportion of women doing this work. And I think, there's also this idea that we need to take whole people into account in doing this work. It's both our staff, but it's also the people that we work with. The nonprofit space often isn't given the full credit that it deserves in terms of the complexity of what it's dealing with, but also the difficult work that it takes, again, to problem solve and to look at really complex challenges at the individual and social level to be able to kind of get at some of the root causes of some of the problems we're dealing with. It's not all about women. Clearly, there are strong male leaders in this space as well. But I think that idea that you need to lead with your heart and your mind together, and that those need to be integrated in terms of how you lead your staff and also how you position your interests and your issues with other stakeholders. these tough problems are not going to be solved with one fell swoop. They are complicated and they need to be looked at from a bunch of different perspectives. And I think it's kind of the feminization of this type of work that's really contributed to really strong leadership across the sector.
Thank you so much, Julia. And then, Ashley, I'm gonna turn to you with this question and then come back to Margot. So Ashley, do you find that there's just something are you working in ways where you are surrounded maybe by women leaders, or and feel something happening in terms of just a difference in terms of gender and what leadership means in the work that you're doing?
Yeah, I think just to echo Julia's sentiments, many of the really strong advocates and leaders in the anti-trafficking field across Canada are women or female identified persons. It's a really kind of female-driven field right now. But, looking at my own experience within the center, we have our two fabulous co-founders who are both incredible business leaders and women. And Julia, who's our executive director, again, is another strong woman. And then I lead a team of three really bright, really dedicated young women as well. So we have fabulous males that work on our staff. But this is a gender-based issue. There's certainly a gender lens that we apply to trafficking. Not to say that men and boys are not trafficked in Canada, but largely what we are seeing are women and girls being trafficked. So having female voices at the table is really important when we're addressing this issue, and ensuring that women are continually at the forefront when we're having conversations with policymakers as well.
Thank you so much, Ashley. And I think that idea of, the number of stakeholders that the work you do involves means having conversations, but also brokering conversations and making sure these conversations happen, putting issues, front and center, being at those tables. And that's something that obviously, it's both feminized, but not, and I think that you are obviously navigating this in such beautiful ways. Margot, I mean, you have led in a couple of fields, in fact, and I wonder if you have thoughts or reflections about whether or not gender has played a role in the leadership that you've engaged in.
I think it definitely has. When I think back to my first business, we had a daycare center. This was in the 80s, okay?
Wow.
Daycare center, breastfeeding rooms, gardens for people to take flowers and vegetables home. That was very, very...
I'm taking notes for my boss. That's amazing.
Gendered, and we had mostly women working in our company. We had 95% women. That being said, over the years, I've worked on many boards for not-for-profits, and I found that there was always a reluctance to have men on the board, possibly because these women had been kept out of leadership positions for so long, kept off of boards, that they were just yearning to be able to put together a philosophy of their own. But I now believe that you need both voices at the table. Mm-hmm. I think that just a man's voice or a woman's voice is an incomplete thought, because men and women are pretty different, but together they're very, very strong. So on our board right now, we have an equal amount of men and women, and it will always be that way. There was a psychologist that I once met. Her name was Carol Gilligan. And she has this phrase that I've always loved, and it's, "A voice without an echo dies." So I think that it's very, very important to have strong women on boards or in management who can listen to other women and echo what they're saying. Because as long as what you've said has an echo, it means somebody's listening, somebody is understanding, somebody is taking it into consideration. So it's terribly important to have at least an equal number of women on boards, in management, in a whole economic capacity. I think that we won't go any further until that happens. And when we do make that happen, we'll become just a very much stronger, more just world with equity.
Thank you so much. I can't think of a more brilliant note on which I want to thank all of you for being in this room, being at this table, and bringing all of your brilliance to the work that you're doing and the ongoing work of equity and social justice in the world. Thank you so much for being a part of this conversation. We are actually coming to the close of our time. So I told you this conversation would go fast, and it did. Thanks to all of you for your questions. I'd like to invite everybody to join us on December 8th at noon for our next series, our next webinar in this series. And it's about my economics degree. What a great decision, which I can't wait to hear more about. But mostly, thank you, Margot, Julia, Ashley. It has been a pleasure. Thank you.
Thank you.
Thank you very much.
Bye-bye.